So we are now recording and just again, just to make sure, are you guys both okay and consent to me recording for training purposes for future instructors?
Yes.
Awesome. Thank you. All right. So Vanessa, first I wanted to start by saying thank you for being a preceptor. I know how much work goes into this, and we really could not do this without your guys' support and you taking on these students and kind of showing them the ropes. So I appreciate your willingness to hop on today and also for just being a preceptor for Shay. It's very noticed. So thank you.
Not a problem.
Our whole purpose of meeting today really is just to kind of see how Shay is progressing through her capstone experience. You guys are on a busy unit up at the University of Utah, so always hopping. And we just have a few things that we go through and kind of see how she started from very beginning to this halfway point. So some of the questions will be for you, Shay. Some of them will be more directed towards you, Vanessa. And we just kind of have this guided conversation. And while we're doing that, I have an evaluation form that I fill out at the same time. That will get back to you, Shay, okay?
Okay, sounds good.
Okay, so I'm going to start with you, Shay. Really quick little pop quiz. Do you remember the 5 steps of the nursing process?
ADPI.
Yes, ADPI, yes.
Mm-hmm.
You remember what it stands for?
Assess, diagnose, planning, implementation, and evaluation.
Spot on. I'm so proud of you. Most people are like,
like, who knows?
But that's really what we go through is the nursing process because that makes up a bulk of our job. So from your perspective, Vanessa, how is Shay doing with the assessment portion? So the actual head to toe and then the documentation portion, if she has the chance to document, how's she doing there?
She's actually doing really good. So, like you said, our unit it's really busy. Not much at night, but during the day it can be very chaotic. So, we don't do a full head to toe, which means from her to the really toe, but we assess exact points of why the person is there. For instance, the person has a spine surgery. Okay, we focus on their assessments and all that stuff. The person is there for a pneumothorax. We assess the lungs really well. We check everything related to it, teaching the IS, try to decrease the amount of oxygen, and yeah, we check all that. So we focus mainly on what the person is going on there. If we notice something extra, like you know what, the person says, you know what, it hurts here too. What? That doesn't look good. It's not related to the injury or whatever happened to you. So let's check. So we do a further assessment on that.
Perfect. And with that, I mean, there's so many little focused assessment types that you have to pick up on. So how is she doing with remembering, okay, this is the lung kind of thing. We're going to go back and we're doing a focus assessment on the lungs. And these are all the pieces that we have to look at with that respiratory assessment. How is she doing there?
She actually is catching up really well. I'm surprised because we're not doing continuous days. We're doing mainly once a week, and some people forget what they done the week before. But she's getting it really well and taking notes.
Fantastic. All right. Okay, so after the assessment, it's kind of, coming up with a plan of attack for the day and prioritizing our care. I know she is early on, and prioritization and time management is certainly a learned skill, but how is she doing in that area?
I think she's doing good too. I asked her, who do we need to see first and why? Tell me why. So she can explain. And if she is not sure, I tell her, you know what? I think we need to see this person first because it's faster, it's easier, that it speak English, whatever. Yeah.
Beautiful. And as far as the kind of hands-on portion of it, so the skills, medication administration, we'll start there. How is she doing in those 2 areas?
I think she's doing really good too. I mean, it's mainly pills. If it's not pills, it's IV stuff. I think we just had one count of core track feeding tube administration. Yeah, It's mainly pills, honestly, but
Perfect.
she is doing properly. And you know what? She tells the patients what pills they're receiving. Actually, maybe I should question what are these pills. Tell me what is it for? I don't know, but she's doing good. I can't
Beautiful.
complain. Yeah.
And how are you feeling with the pace and the assessments and the med administration and skills, Shay? It's a lot to absorb in a little amount of time, right? So how are you feeling about all that?
I feel good. I definitely think every shift I get, just a little bit farther. So I feel like we've done 4 shifts so far. So I'm happy with how I've progressed, but there's always, so much more to learn. So
Yeah, I think it's important to remember that the capstone is really just kind of like a nice introduction and your hands-on of application of all you've learned in school.
Mhm.
And I love it when you guys have such high expectations of yourself, but I also want you to be kind to yourself because you certainly aren't going to be a nurse in only 8 shifts. It takes a little bit to get there, but keep growing. That's fantastic. Kind of progressing forward, Vanessa, how is she doing with communication? So communication with interdisciplinary staff and then also with our patients.
I think she's doing really well with the patients. Maybe I need to tell her. Maybe next time I'll give her my phone so she can
Okay.
answer the CNA's calls and tell them what they need to do. Um, if there is a patient who is upset or I don't know, it's a little out of here right now or at the moment, I step in and just tell
Yeah.
her just watch.
Yeah. Yeah, it's, so that's one of the wonderful things about having a preceptor is it's like, help me, and they can step in. How do you feel about taking the phone, Shay?
I feel good about taking the phone. I think I've been giving a report recently and that has been like, nerve-wracking, but I'm learning quickly as I go. So
I like that
Perfect.
you actually take a lot of notes, and sometimes I honestly don't take notes because it gets in my head. But then she mentioned, "Oh yeah, that person said that." Okay, good. That's great.
Perfect. Okay, and then perfect. It sounds like we're doing good. We're doing report. We're gonna step up our responsibility with taking the phone next shift. Um, Shay, I'm gonna ask you, have you had an opportunity to delegate yet to a CNA or to another nurse or anything on the unit?
I think with CNAs, we've kind of had a joint
Okay.
responsibility for delegation. Like we had a patient the other day that kind of needed more support, and the CNA was able to go in there more frequently and kind of help like calm her down. So it's kind of been a joint delegation role. So.
Perfect. Perfect. Keep practicing with that because it's delegation, the act of asking is easy, right? But it's knowing how to delegate and when it's appropriate to delegate. Like that's kind of the skill behind that. And then Vanessa, how is Shay with questions and then receiving feedback?
I think she's taken it really well when I mentioned something on questions. I think she's been asking a few things, not much, but I mean, she's catching things well.
Perfect. Shay, I'm gonna encourage you to, whenever you have a question, just ask it, right? That's the best thing to do. I had a saying as a charge nurse, a quiet new nurse is a scary new nurse, right? Because we know you don't know what you're doing. But if you just voice those questions or about how those dots are connected out loud, it helps us understand and progress you a little bit faster. So don't hesitate to ask those questions. You got Vanessa here. Sounds like Vanessa, and I appreciate this because not every preceptor is this way, but you're willing to let Shay grow and stretch and take on these responsibilities, and not every preceptor is willing to do that. So I appreciate that. So thank you. Okay, my last questions that I have for you, Vanessa, and not that I anticipate any issues, but I am required to ask. Has Shay attended all of the clinicals as scheduled and stayed for the entire time?
Yes.
Perfect. And has there been any issues regarding safety with medication administration or skills and procedures?
No, at all.
Fantastic. Okay, well that wraps up our portion with you, Vanessa. Again, thank you so much for hopping on. I appreciate it and then enjoyed talking with you. You guys will probably meet with Laura for the final, but we'll let you get back to your day. And then Shay, I'm going to hold on to you for a few minutes and we'll tell you how to turn everything in, okay?
Sounds good. Thanks, Vanessa.
Thanks.
No,
Thank you.
Shay. Thank you. Bye. Have a good day. No, I don't know how to turn this off. Okay, here we go.
Perfect. Bye. All right, Shay. Well, how do you feel like it's going?
It's going well. It's like you said, a lot of information for sure. But yeah, I'm just like trying to grasp onto everything that I can. So
Perfect. I appreciate you taking notes and writing things down, right? I mean, yes, there are nuances to every type of unit, but those processes still stay the same. Like you still have to manage your time. You still have to prioritize. You still have to make sure your assessments are solid and just kind of tweaked a little bit to meet the needs of that specific unit, right? And so keep moving forward with all of that. Any questions about assignments or anything right now?
no, I think I'm okay. I've turned in 3 of my like goal assignments, and so the rest will just be before the final. And yeah.
Perfect. And yeah, you can just keep turning them in. You know, if you have a really solid shift where I don't remember seeing which goal assignments you turn in. You have like medication knowledge and delegation ones. So there's a few left. If you have like a super solid day where you prioritize and you do an S bar at the same time, just like knock both goals out of the single shift, right? The whole purpose of those assignments is to expose you guys to the process of how to do those. Not necessarily it's like one goal per shift. So if you want to go faster with them, you can. As far as kind of end game for you, what does that look like? Do you have job prospects kind of lined up or not sure yet, or what are your thoughts?
Yeah, so I worked at the U for a really long time, so that's why with my capstone I knew like I don't mind where I am really. I just like that hospital system. So I'm really hoping, you know, with my connections that I have there, I can stay at the U. And I've been really loving the ortho trauma unit. I think the patient population is awesome, the pace is good. So
Okay, well, if this is something you might be interested in, I know OTSS, they pick up new grads and they usually post some positions here. I would start looking at those and seeing what's available and start applying right now because they know that your NCLEX date, right, is going to be a little pushed out for graduation, but they start working on all those hirings right now with the understanding that you're going to be graduating soon. So I would look at the postings that are available. If they're not available yet, I would recommend setting up a meeting with the hiring manager on OTSS and just seeing prospects of if they're going to have job openings and what you could do because you really like it there, like what you could do to put yourself in a position that gets you into the door. Faces to names really, really help when they're going through all of those resumes and everything else. So if you have one that's already created, have you guys finished that assignment in transitions yet?
not yet. I think
Okay.
it's too soon though. So.
Okay, so working on through that resume, that's something that you could give to the hiring manager and be like, pick me, right? Or what could I do? And if Vanessa would be willing to also, you know, be a voice for you as a reference, that would also go a really long way. So I would just chat with Vanessa as you kind of get towards the end of your capstone and kind of plant the seed, right? Of like, well, I really like it here. So could see myself working here. What could we do to make that happen? Okay.
And just like Hannah
Um,
mentioned, like
oh
what
yeah,
can
go
we
ahead,
do to
Michael.
make this happen? Be specific on what you're hoping to get back from them. Like, you know, is there a time frame I could hear back from you as far as this, or
Yeah.
give them some sort of like expectation of what you want
Mhm.
back from them, and that way it's not just like, well, they never told me anything, and so the opportunity just disappeared, right? So
Mhm.
a little bit of I think they like when people are proactive and a little bit assertive at you know, voicing that interest and saying, I want this job, I'm all over it, like it
Yeah.
would be great to work here. And they usually are gonna like Hannah said, they're gonna put your face to that name and they're gonna pick you. So
Yeah, that's good advice.
All right. Well, you're all set on track for the rest of your shifts, on track to for getting all your hours completed. Okay, beautiful. Now, one of the things I wanted to mention to you, and Laura will probably mention again at the final, but at the University of Utah, they do have a survey that they send out to you guys at the or close to the end of the semester. It'll be from a gal named Malia, and it basically is just like asking how your capstone went. So please make sure that you fill that out. They are very remindy about getting those completed for you guys. So
Yeah.
beyond that, any questions, comments, concerns?
No, I think everything's going well so far.
Okay, perfect. I do too. I think you're right on track. So keep moving forward, keep pushing yourself each shift, which it sounds like you're doing a great job of. As far as your evaluation goes, I'm just going to finish typing it up and then I am going to send it to you in exact. And then you'll just go into it. If you need a reminder, there's that video on the Canvas page that walks you through where to find it in the Canvas page. Or not Canvas, in the exact kind of course page. You'll electronically sign it, you'll send it back to me, and then that's when you'll get your points for the evaluation submission assignment, okay?
Okay, that sounds good. Thank you
All
guys
right,
so much.
perfect. Thank you. We'll talk to you later.
Bye. Have a good day.
Bye. All right, so I'm gonna just show you, Michael, how we wrap everything up. Now, what I've been doing on my end, I'm gonna share my screen,
you still want to be
is yes, because then I'm gonna show everybody else like where to turn in all of this,
perfect.
how to like fill it all out. Okay, so here's an example of the evaluation for the midterm. And it can be found, oops, no, stay. I don't want to do that. I almost erased everything. That would have been really bad. I'll show you where to find it afterwards.
Yes.
But this is just like at the midterm, they can have a needs improvement and that gives them an opportunity to correct it, right? So most of the time, and they're satisfactory. They're right where they need to be in this progression of moving forward. The things that we see most commonly are going to be attending clinicals as scheduled and arriving and leaving at designated times. Like sometimes they want to show up late a few minutes, like every single shift. Like we had that happen last semester. And that was mentioned in the midterm, but it gives us an opportunity to be like, hey, we got to fix this because this is not at the standard that you need to be. So we also might have like assessment ones, here and there. It's totally appropriate to do a needs improvement and then just knowing that we're moving into that satisfactory at the final. Now, as we meet, what I like to do is I kind of have a script. So I'll just say Hannah and Shay and Vanessa, and I'll just do like in parentheses her preceptor, met for the midterm evaluation relating to her capstone experience. And then what I like to try to do, and I'll just type this all out, is I'll take direct quotes from the preceptor and throw that into the evaluation so that we have this record of like they're doing well, they're not doing well, and these are the areas. And then at the end, if there's anything that they plan on doing, like right here, next time Vanessa is going to give her phone to manage the delegation of the CNAs, right? So that we can have that show of this is the plan moving forward. Afterwards, you literally just sign it. And then here,
You're missing one of the section 5ers or yeah.
Oh, yep, perfect. If you don't, it will not let you save it.
Okay.
Okay. Oh, I'm missing an R. I was like, I'm pretty sure that's spelled right. No, it's not. Okay, after we do all our comments, then we press submit and then press update. And then it shoots it off to the student. And
Cool.
on our end, it will say pending student review. As soon as they've signed it, it will say pending faculty review. And then we'll just go in, make sure they signed it, and then we assign their points. So the points that we assign, we go to just the grade book. And then there's a few places. So we'll check all of this stuff before we actually meet and make sure that for every shift that they've worked, they've turned in an evaluation and a journal, and that they've turned in the goal assignments that they needed to. So at the midway point, they've needed 3 goal assignments in total because they have 6. So we say 3 before the midterm, the other 3 before the final, unless you go faster than that. And then here's where we do our points for our check-ins. So we're at the midterm evaluation check-in meeting, so we'll assign her points there. And then if at any time like she was missing assignments or she didn't show up or anything like that happened, then she would lose professionalism points. But she doesn't have any loss on that. She's been doing everything like she's supposed to, as outlined in the capstone handbook, which is exactly how we hope it goes, but it's not always the case. If there's ever a reason why we need to deduct professionalism points, we always put that in the comment section. So instead of just taking away points, we'll take away points and we'll say, in parentheses, this is how many points he lost. This is why. So it's very clear about when those deductions happen for the student.
So even for the midterm portion, if they're showing up late and the preceptor's like, yeah, they're a few minutes late on average, then you would go into this area and take off. I mean, how do you know how many points to take off for different problems, or is it just
It's 10 points for each what we call infraction.
okay?
So, and I'll show you where we can find those. But as far as running through the midterm, that's what the meeting looks like, where it's just like we have the preceptor. The longest we keep our preceptors for is 15 minutes.
Okay.
And then we usually take about the 30 minutes total when we finish up with the preceptor and just kind of wrap up with the student and say, these are the next steps for you to move forward. So hurry up and get that taken care of with them and then move on. Okay, so that's the midterm. I'm gonna end this so that we can stop the recording and then we'll keep diving through the rest of the capstone stuff. Good?
Okay.
Okay.
Yeah.
Do you want to hop back on to Teams?
Sure.
Okay. Okay. Bye.
Mm.